One of the biggest reasons people are anxious about GLP-1 weight loss injections is side effects. You'll see extreme stories online. Some people say they couldn't tolerate it at all, others say it changed their life. Both can be true, and the difference usually comes down to biology, dose, and how the medication is used. In this video, I want to explain GLP-1 side effects properly. What causes them, what's normal, what should settle with time, and what should never be ignored. Let's start with the most common side effect, nausea. Nausea happens because GLP-1 medications slow stomach emptying. Food stays in the stomach longer, which increases fullness but can also trigger nausea, especially early on or when doses are increased too quickly. This is why dose titration matters so much. These medications are designed to be started low and increased slowly. When people rush doses or skip steps, side effects are far more likely. Constipation is another very common issue. Slower gut movement combined with reduced food intake can lead to harder stools. Hydration, fiber balance, and sometimes gentle laxatives are often needed. On the other side, some people experience diarrhea. This is usually temporary and often linked to dietary changes or rapid dose escalation. Reflux and bloating can also occur. Again, these are usually dose-related and improve over time when managed properly. Now let's talk about appetite suppression. Reduced appetite is the goal, but sometimes it becomes too strong. People forget to eat, struggle to get enough protein, or feel fatigued. This is where clinical oversight matters a lot. Weight loss should never come at the expense of muscle mass or nutritional deficiency. More serious but less common risks include gallbladder problems. Rapid weight loss increases the risk of gallstones. This isn't unique to GLP-1 medications. It happens with any rapid weight loss, including after bariatric surgery. That's why gradual, steady weight loss is safer than dramatic drops. There are also people who should not use GLP-1 medications, including those with certain gastrointestinal conditions or a personal or family history of specific endocrine cancers. This is why proper screening is essential. What's the key message? Side effects are not a sign of failure. They are signals. Most can be managed with the right dose, the right pace, and the right support. But some symptoms should never be pushed through. Severe abdominal pain, persistent vomiting, dehydration, or symptoms that worsen rather than improve need urgent review. GLP-1 medications are powerful tools, but they need to be used thoughtfully. If you want a practical video on how clinicians decide whether to reduce a dose, pause treatment, or stop altogether, comment dose. And if you value calm, evidence-based explanations of health and metabolic medicine, subscribe to the channel.